प्रयास है। इस आयोजन में भगीरथी मेडिकल फाउंडेशन का भी महत्वपूर्ण सहयोग प्राप्त है। अब कार्यक्रम का शुभारंभ भगवान श्री धन्वंतरी के स्मरण के साथ करते हैं, उनकी वंदना के साथ। नमामि धन्वन्तरिमादिदेवं सुरासुरे वन्दितपादपद्मं लोके जरारोगभयमृत्युनाशं दातारमीशं विविधौषधीनाम् चव्योमवातवनिवारिवह्निं पंच प्रपंचात्मक देहभाजं संताप संपात ज्वरांतकं नमामि धन्वन्तरिमादिदेवं। नवीन नीलं मुदकान्तिकान्तं शान्तं हरे द्वादशमाख्यमूर्तिं पूर्तिं सतनां सुमनोरथानां नमामि धन्वन्तरिमादिदेवं। नमामि धन्वन्तरिमादिदेवम्। अब मैं आज के इस कार्यक्रम की हमारी आदरणीय उद्घाटक डॉक्टर प्रतिभा आनंद फाटक जी का संक्षिप्त परिचय प्रस्तुत करना चाहूंगा। डॉक्टर प्रतिभा फाटक जी सावित्रीबाई फुले महिला एकात्म समाज मंडल संस्था की संस्थापक कार्यवाह हैं। आप पिछले 33 वर्षों से स्वास्थ्य, ग्राम विकास एवं महिला सशक्तिकरण जैसे महत्वपूर्ण क्षेत्रों में निरंतर कार्यरत हैं। इसके साथ आप महिला एफपीओ की मार्गदर्शक के रूप में भी महत्वपूर्ण भूमिका निभा रही हैं। वर्तमान में आप संस्था के एक्सीलेंस विभाग की प्रमुख हैं तथा डॉक्टर हेडगेवार रुग्णालय संस्था की ट्रस्टी के रूप में भी सेवाएं दे रही हैं। ग्रामीण एवं आदिवासी क्षेत्रों में विकास कार्यों में आपका योगदान अत्यंत प्रेरणादायक रहा है। अब मैं विनम्रता पूर्वक आमंत्रित करता हूं आदरणीय डॉक्टर प्रतिभा आनंद फाटक जी को कि वे अपने उद्घाटक एवं मार्गदर्शन से हम सभी को लाभान्वित करें। मैम। हेलो। हेलो। हेलो मैम।
अनम्यूट किया है उन्होंने, लेकिन आवाज नहीं आ रही है।
ठीक है सर, मैं करता हूँ।
अभी दिख रही है?
हेलो, मैडम को अनम्यूट करने लगाइए।
हाँ
हाँ, एक मिनट।
हेलो।
हेलो, यस मैम, आपका आवाज आ रहा है मैम।
सर, उनकी आवाज नहीं आ
हेलो।
रही है।
यस
हाँ
मैम,
हाँ, आ रही है, आ रही है।
आपकी आवाज भी आ रही है, आप दिख भी
हेलो।
रहे थे मैम। हेलो।
हाँ,
यस
नमस्ते।
मैम।
मुझे
नमस्ते
कुछ
मैम।
भी सुनाई नहीं दे रहा है, सिर्फ स्क्रीन पे अपना आरोग्य भारती का बैनर दिख रहा है, लेकिन अभी मैं बात कर रही हूँ।
यस मैम, आपको मेरी आवाज सुनाई दे रही है मैम?
मैं डॉक्टर प्रतिभा फाटक संभाजी नगर महाराष्ट्र से हूँ और सावित्रीबाई फुले महिला एकात्म समाज मंडल नाम से एक स्वयंसेवी संस्था है, उसी के अंदर काम करती हूँ। और डॉक्टर हेडगेवार रुग्णालय का नाम शायद आप में से कई लोगों ने सुना होगा। तो ये डॉक्टर हेडगेवार रुग्णालय की सिस्टर कंसर्न ऑर्गेनाइजेशन है। हेडगेवार हॉस्पिटल तो 89 में शुरू हुआ और उसी के साथ साथ समाज में भी सिर्फ वर्टिकल ग्रोथ हॉस्पिटल की ना हो तो समाज में भी हॉरिजेंटली प्रिवेंटिव कामों में संस्था लगे, सेवा कार्य के माध्यम से सोशल ट्रांसफॉर्मेशन लाए। इसी कारण सावित्रीबाई फुले महिला एकात्म समाज मंडल संस्था की स्थापना हो गई। और आज मुझे बहुत प्रसन्नता होती है कि सावित्रीबाई फुले महिला एकात्म समाज मंडल का कार्य अब महाराष्ट्र के लगभग 12 जिलों में 970 गांवों में और जालना और संभाजीनगर और परभणी ऐसे शहरों के लगभग 79 सेवा बस्ती में कार्य चालू है। आरोग्य के माध्यम से ही एंट्री पॉइंट प्रोग्राम आरोग्य ही रहा है और तब से लेकर आज तक आरोग्य के विषय में अनेक प्रकल्पों के माध्यम से ये काम चालू है। उसमें सेवा बस्ती में माता बाल आरोग्य है, एनसीडीज है, एनीमिया कंट्रोल प्रोग्राम है, एडोलसेंट हेल्थ प्रोग्राम है, कम्युनिटी ईयर स्क्रीनिंग प्रोग्राम है, कम्युनिटी ऑप्थल्म प्रोग्राम है। ऐसे लगभग पेडियाट्रिक टू जेरियाट्रिक सभी तरह का प्रकल्प के माध्यम से ये काम चल रहा है। सुदूर नंदुरबार जिले में भी ये काम चल रहा है और ग्रामीण क्षेत्र में यहाँ की संभाजीनगर शहर के 120 गांवों में काम चल रहा है। उसमें से सभी गांवों में माता बाल आरोग्य ये प्राथमिकता रही है ग्रामीण क्षेत्र में और नंदुरबार जैसे सुदूर क्षेत्र में। माता बाल क्षेत्र में काम करते समय किशोरवयीन लड़कियों के साथ में पहला प्रोग्राम शुरू हो गया। किशोरवयीन लड़कियों के स्वास्थ्य के लिए बहुत सारे उपक्रम चलते हैं। उसके बाद प्रेगनेंसी केयर है, उसके बाद नियोनेटल केयर है, स्कूल गोइंग बच्चों के लिए 5 अच्छी आदतें डालना उनमें और दिनचर्या में ये चीजें लाना, ऐसी बात हो रही है। जिला परिषद के लगभग 140 स्कूल के टीचर्स और बच्चों के साथ में ये प्रोग्राम चालू है और उज्जवल भारत नाम से ये प्रकल्प चलता है। उसके बाद किशोरवयीन लड़के लड़कियों का तो प्रोग्राम है ही, नियोनेटल केयर है, एएनसी केयर है। हमने 2003, 4 और 5 ये 3 सालों में ग्रामीण क्षेत्र में जो आरटीआई एसटीआई है अपने रिप्रोडक्टिव ट्रैक्ट इन्फेक्शंस और सेक्सुअली ट्रांसमिटेड इन्फेक्शंस, उनके बारे में भी गवर्नमेंट के साथ में काम किया था और मुझे बहुत खुशी होती है शेयर करने में कि लगभग 23% इतना प्रिवेलेंस इस विषय में था। अभी जाकर वो उस 3-4 साल में जो काम हुआ है उसके बाद में 7% तक आरटीआई एसटीआई का प्रमाण कम हुआ है। ये बहुत ही अच्छे इंडिकेटर्स हैं। छोटे छोटे उपक्रम होते हैं, हर बार बहुत बड़ा कार्य करने की जरूरत होती है ऐसा नहीं है। के लिए हमको जांच करनी चाहिए। जांच करने के लिए ग्रामीण क्षेत्र में या ट्राइबल एरिया में या अपनी सेवा बस्ती में लेडी डॉक्टर मिलना, उसने परवजाइनल एग्जामिनेशन करना, ये भी बहुत दूर की बात लगती थी। अभी तो बहुत अच्छे गवर्नमेंट की भी सीएचओ वगैरह आई है, लेकिन मुझे नहीं लगता है कि अभी भी इंटरनल एग्जाम हो रही है या बहुत अच्छे तरीके से उसमें काम चल रहा है, ऐसे नहीं लगता है। तो वहां तक जाना, उन महिलाओं को इन विषयों के बारे में बोलने के लिए प्रवृत्त करना। नहीं तो हम लोग सभी ओपीडी में बैठते हैं तो महिलाएं आती है तो अपनी गायनिक प्रॉब्लम कभी नहीं बताती। वो बताती है सिर्फ मेरी गर्दन दुखती है, मेरी पेट दुखती है, मेरे पैर दुखते हैं, वाइट डिस्चार्ज है, ये कंप्लेंट मुंह से निकालने के लिए भी उसको शर्म आती है। तो इस चीज में जो भी कोई हमारी जैसी डॉक्टर, हम सभी अभी, मुझे पता नहीं है, कुछ सुना ही नहीं दे रहा है इसीलिए कि कौन है इस सभा में। तो जो भी कोई डॉक्टर जाता है ऐसे रूरल एरिया में और सेवा बस्ती में, तो उसका प्राथमिक कर्तव्य ये होता है कि आगे बैठी हुई जो बहन है उसको थोड़ा आश्वस्त करे और वो अपनी कंप्लेंट खुलकर बताए, जो भी उसके मन में है वो बताए और जांच के लिए वो प्रवृत्त हो। ऐसे सभी काम हो रहे हैं। मैंने जो बताया कि नंदुरबार में जो काम चल रहा है उसमें लगभग नर्मदा के किनारे जो सुदूर हैमलेट्स है, जो जनजाति क्षेत्र है, जनजाति गांव है छोटे छोटे, उनके 240 ऐसे गांव में वहां पे काम चल रहा है। डॉक्टर तो नहीं जा सकते, तो लेकिन हमने वहां की जो आशा वर्कर है उन्हीं को ट्रेन किया और माता बाल आरोग्य के लिए केयर मदर आनंदी माँ ये किट और एप्लीकेशन के साथ में हाई रिस्क प्रेगनेंसीज को जल्दी आइडेंटिफिकेशन करना और टाइमली उनका रेफरल होना, इसके लिए उनको प्रशिक्षित किया। और मुझे आनंद है कि एवरी ईयर 1000 से भी ज्यादा प्रेगनेंसीज वहां पे डोर स्टेप केयर उनको मिल रहा है, हाई रिस्क प्रेगनेंसीज आइडेंटिफाई हो रही है और उनका आउटकम भी अच्छा आ रहा है। वहां पे तो एक और बड़ी समस्या है कि 94% महिलाओं में जो रिप्रोडक्टिव एज ग्रुप की महिलाएं हैं उनमें एनीमिया का बहुत ही बड़ा प्रादुर्भाव है। 96% महिला एनीमिक है। तो हमने वहां पे एक अच्छा प्रोग्राम, जो कि माता कणिक कंसरी, वहां की ट्राइबल अन्न धन्य की जो गॉडेस है, समृद्धि की जो गॉडेस है माता कणिक कंसरी, उसी के नाम से एक प्रोजेक्ट शुरू किया और फूड इज मेडिसिन कंसेप्ट लेकर उसमें जो भी वहां पे जो तृणधान्य होते हैं, जो भी वहां पे सब्जियां होती है, जो भी वहां पे फल होते हैं, जो भी औषधि वनस्पतियां हैं, उनको थोड़ा सा प्रमोट करना और राउंड द ईयर 15 टाइप्स ऑफ वेजिटेबल्स उनके आहार में किस तरह आए, ऐसा काम चल रहा है। और मुझे इसी बात का भी आनंद है कि 3 साल में 95% से लेकर जो कॉन्सेंट्रेटेड एफर्ट्स हमने कुछ हैमलेट्स में किया है, उससे प्रिवेलेंस एनीमिया का 54 तक आ गया है। 40% एनीमिया सिर्फ एक भी दवाई नहीं, गोली नहीं, सिर्फ आहार में परिवर्तन और उनके बिहेवियर में थोड़ा सा परिवर्तन, जो भी चीज खाते नहीं थे वो जहाँ पे वहां पे होती थी लेकिन वो खाते नहीं थे। जैसे कि वहां पे भगर एक तृणधान्य है, जो वरी सावा बरटी बोलते हैं, ऐसे बहुत से अच्छे, एक काली जवार है वो भी होती है, लेकिन लोग सब मकई की रोटी खाते थे तो उसका कुछ भी बेनिफिट नहीं रहता था। तो जो वहां पे उगता है उसी को आधार, प्रकृति को आधार लेकर ये जो बदलाव उनके जीवन में आहार के बारे में लाने के लिए थोड़ा सा कॉन्सेंट्रेटेड एफर्ट्स हुआ। तो विदाउट मेडिकेशन, विथ ओनली विथ फूड इज मेडिसिन कंसेप्ट से 40% तक का एनीमिया का प्रिवेलेंस कम करने में मदद हुई है। वहां पे सिकल सेल एनीमिया का भी प्रादुर्भाव है, तो अर्ली आइडेंटिफिकेशन करने के लिए सिकल सेल का कार्ड टेस्ट वहां पे देकर सिकल सेल का भी ये किया जाता है, डायग्नोसिस किया जाता है। ऐसे काम हो रहे हैं। महिलाओं के लिए विशेष तौर से ये काम चल रहा है। दूसरा, यहाँ के ग्रामीण क्षेत्र में हमने काम करते समय जैसे ब्रेस्ट कैंसर है, स्क्रीनिंग है, सर्वाइकल कैंसर स्क्रीनिंग है, ऐसे भी स्क्रीनिंग प्रोग्राम्स किए हैं। और ये सब उपक्रम करते समय जो भी अपनी सांस्कृतिक परंपराएं हैं उनको अगर साथ में लेकर करते हैं तो अवेयरनेस करते समय कम्युनिटी एंगेजमेंट बहुत अच्छी बढ़ जाती है। जैसे सामूहिक नामकरण है, सामूहिक गोद भराई का प्रोग्राम है, सामूहिक उष्टावन के कार्यक्रम है, सासू सम्मेलन है, ऐसे अनेक अनेक छोटे छोटे नए नए नव दंपति के लिए कुछ कौतुक यानी उनकी सराहना करने के लिए, उनको प्रमोट करने के लिए ऐसे कुछ कार्यक्रम किए जाते हैं। तो संस्था के द्वारा ऐसे उपक्रमों से माता बाल आरोग्य के क्षेत्र में कुछ अच्छा काम इन गाँव में हो रहा है। आप सभी के साथ ये काम शेयर करते समय मुझे आनंद हुआ और आज आरोग्य भारती का इतना अच्छा उपक्रम है, इसकी मुझे पहली बार जानकारी हो गई है। आयुर्वेदा भैसनम ये इतना अच्छा सभी आप स्टूडेंट्स है, पोस्ट ग्रेजुएट डॉक्टर्स है, सभी समाज के बड़े कार्यकर्तागण इसमें शामिल हो रहे हैं और आयुर्वेद को आगे ले जाने के लिए कार्य हो रहा है। दुर्भाग्यवश मेरा आयुर्वेद का पढ़ाई हुआ है, लेकिन मैं ये सोशल फील्ड में आ गई हूँ और प्रैक्टिस में आयुर्वेद कम रहा है, तो मुझे मैंने सर से बताया था कि मुझे शर्म आ रही कि ऐसे प्रोग्राम में मैं कैसे शेयर करूं कि मैं खुद आयुर्वेदा का प्रैक्टिस नहीं कर रही हूँ। लेकिन बहुत ही इच्छा है कि दिनचर्या जो हमारा उपक्रम है वो दिनचर्या वाला या ये फूड इज मेडिसिन वाला, इसमें भी थोड़ा तो भी कंट्रीब्यूट कर सकी हूँ। फूड इज मेडिसिन में तो हमने वहां पे जो उगने वाली है उनके घर के सामने 5 प्रकार की औषधि वनस्पतियां हो, जो किचन गार्डन है जो वहां में 5 प्रकार की औषधि वनस्पतियां हो, 5 प्रकार के फल वृक्ष हो और 15 प्रकार की सब्जियां उनकी आंगन में हो, ऐसा उपक्रम शुरू किया है। और अभी मुझे और एक आनंद की बात आपसे शेयर करनी है कि वो कॉपकॉर्ड मतलब संधिवात का जो डिसीज है, रोमेटोलॉजी इधर एलोपैथी में, तो उसके लिए कॉपकॉर्ड का एक ग्रांट लेकर रिसर्च स्टडी कम्युनिटी में किया। 17,000 लोगों का स्क्रीनिंग किया, उसमें से जो भी निकल के आए 3 फेजेस में रोमेटोलॉजिकल डिसऑर्डर कितने हैं ये देखने के लिए। और अभी आयुर्वेदा का जो संशोधन विभाग है अपनी भारत सरकार का, उसी से एक ग्रांट लेकर इसी अप्रैल अक्षय तृतीया के मुहूर्त से आयुर्वेदा कॉपकॉर्ड ऐसा एक कॉम्बिनेशन में कि जो भी आयुर्वेदा का कंसेप्ट का संधिवात का है और रोमेटोलॉजी एलोपैथी का है, तो उसमें कुछ कोरिलेशन है क्या, ये देखने के लिए ये एक आयुर्वेदा का रिसर्च स्टडी अभी हमने स्टार्ट किया है। तो आप सभी को इस सत्र की उद्घाटन के लिए शुभ उद्घाटन हुआ ऐसा मैं प्रकट करती हूँ। और आगे जो विषय होने वाला है राधिका मैम प्रेजेंट करने वाली है। मुझे कुछ सुना ही नहीं दे रहा है, लेकिन मैं फिर भी एक बार और लेफ्ट होकर ट्राई करूंगी, मुझे भी सुनने को लेक्चर मिले। इस ऐसे शुभ काम और ऐसे आयुर्वेदा को प्रमोट करने के लिए जो भी कार्य हो रहे हैं, आरोग्य भारती द्वारा अनेक सेवा कार्य चलते हैं, सभी कार्यों को शुभकामना देती हूँ। धन्यवाद।
खूब खूब धन्यवाद मैम। आपका आयुर्वेद क्षेत्र में जो आयुर्वेद का प्रथम प्रयोजन है स्वस्थ से स्वास्थ्य रक्षण, उसको आपने सभी समाज के स्तरों तक पहुंचाने का मतलब एक सभी क्षेत्र में पहुंचाया है एवं मार्गदर्शन दिया है। और आपके इसी नेतृत्व हम सभी के लिए अत्यंत प्रेरणादायक है। नारी स्वास्थ्य केवल एक व्यक्ति का विषय नहीं, बल्कि पूरे समाज के स्वास्थ्य का आधार है, ऐसा आपने हमें समझाया है। आज का हमारा विषय है फ्रॉम ओपी टू ऑप्टिमल केयर, आयुर्वेदिक सॉल्यूशन फॉर द कॉमन गायनेकोलॉजिकल प्रॉब्लम्स। अब मैं आज की हमारी विशिष्ट वक्ता डॉक्टर राधिका सतीशेषन मैडम का परिचय प्रस्तुत करना चाहूंगा। डॉक्टर राधिका सतीशेषन मैडम एक प्रख्यात आयुर्वेदिक स्त्री रोग एवं वंध्यत्व विशेषज्ञ है। आपने बीएमएस एवं एमएस में उत्कृष्ट शिक्षा प्राप्त की है। आपने मेल इनफर्टिलिटी मैनेजमेंट एवं आयुर्वेदा कॉस्मेटोलॉजी में विशेष प्रशिक्षण भी प्राप्त किया है। आपका मुख्य कार्य क्षेत्र पुरुष एवं महिला वंध्यत्व प्रबंधन है, जहां आप आयुर्वेद के सिद्धांतों को आधुनिक दृष्टिकोण के साथ जोड़ती हैं। आपने 30 से अधिक रिसर्च पेपर प्रस्तुत किए हैं और बेस्ट पेपर प्रेजेंटर अवार्ड भी सम्मानित हुए हैं। आप अ क्लिनिकल हैंडबुक ऑन इनफर्टिलिटी केसेस जैसे उपयोगी पुस्तक की भी लेखिका भी हैं। डॉक्टर राधिका मैडम ने 100 से अधिक दंपतियों को सफलतापूर्वक मातृत्व पितृत्व प्रदान करने में सहायता की है। वर्तमान में आप वैद्यरत्नम आयुर्वेद महाविद्यालय केरल में असिस्टेंट प्रोफेसर के रूप में कार्यरत हैं। अब मैं विनम्रता पूर्वक आमंत्रित करता हूं आदरणीय डॉक्टर राधिका सतीशेषन मैडम को कि वे अपने अमूल्य विचार प्रस्तुत करें। मैडम।
Thank you, Dr. Avinash Labana, for a wonderful introduction. First of all, I thank Arogya Bharati for giving me this opportunity to speak about the OP management of common gynecological problems. And also, I was just listening to Dr. Pratibha Phatak, Madam. Such a wonderful initiation. And as you told that you are not practicing Ayurveda, but you are, yes, indeed, you are doing a great job by practicing the whole subjects of Ayurveda from Kaya Chikitsa to Prasuti. So thank you, Madam, for this wonderful, for sharing your inputs on this wonderful initiation. So let me share my, can I share my screen?
Yes, ma'am. Visible, ma'am.
Okay, great. Sorry. Just a moment. I hope it's visible, right? Am I audible also?
Yes, ma'am, you are audible.
Okay, thank you. Thank you, sir. So, a very warm good evening to one and all. So, myself, Dr. Radhika Satheesan, and I am from Kerala. So, I'm really sorry that my Hindi is not good. So, hence, I'll be speaking to you in English, and I hope it's fine for you. Okay. So, I'll just start my session. So, first of all, these are my contents of my session. So, I would like to start today's session with this important shloka, which states the abnormalities or which shares us or which gives us an information about the causes for all the gynecological diseases. So we know that there are mainly two things we need to keep in mind. First one is ahara. Second one is our mind or our mental status. These two are one of the major causes for almost all kinds of gynecological diseases. So here, our acharyas have specifically told us about the diet aspect and about the mental aspect as well. So we know that abnormal diet, abnormal viharas, any kind of mode of life or any lifestyles, abnormal lifestyles, and can cause abnormalities in both artava, that is the egg, and the bija. Okay. And we know that also our mental status, that is the Daiva Kopa. Daiva Kopa stays karma bala, carries a great cause for all kinds of gynecological diseases. We do get a lot of people coming to us and stating that, Madam, I have been using all kind of good medicines, good lifestyle and everything. And why did I get this condition? So it might be because of your karma bhala, or it might be because of some kind of deva kopas that has occurred. And also, Vagbhada Acharya has specifically told about having coitus in abnormal positions, which needs to be taken care and which is very prevalent in today's era. And this is not so common, but even though Kashyapa has told us administration of Nasya during the menstrual period. So while we are conducting any kind of Panchakarma procedures, we need to be taken care that Nasya is not performed during the period of menstruation. Okay. So here I'm introducing a new concept called as gut, mind, and endocrine cycle. You might have heard about the gut brain axis. I think nowadays it's very prevalent and it's very much used by all the doctors around the world about the gut brain axis. So here I'm introducing a new concept called as gut mind, and endocrine cycle. So you might be thinking, why is gut and mind? Or why is mind and endocrine cycle, how is it related? We know that cortisol, we know that hypothalamus releases a lot of hormones, especially the GnRH hormone, and pituitary releases a lot of hormone, out of which FSH, LH, and cortisol are one of the prime hormones. We know that stress can affect our gut mobility and microbiota. And also, gut inflammation can send signals, stress signals, back to the brain. This can ultimately hamper the hormones or the endocrine system. So, thus, it's a vicious cycle where the stress, gut disturbance, then causing more stress and causing hormonal imbalances. And these hormonal imbalances, which are basically caused due to the gut, due to any kind of indigestions or any kind of gut related issues, and also any kind of mind related issues, especially stress, can hamper the endocrine system and also cause different types of gynecological diseases. So I have specifically introduced this concept to make you aware that whenever you get a lady in your OPD, you should first ask her properly about her ahara, her vihara, and her mental status. Without asking these three things, you cannot go forward with her, with helping her with her condition. Okay. So basically, I will be discussing all the common kinds of diseases that comes to an OPD. So first of all, we'll go with fibroids. So what are fibroids? These are basically growths that happen in the walls of the uterus, and they consist of smooth muscle cells and connective tissues. And it is very commonly seen from the age of 30. But nowadays, we can see that fibroids can occur from the age of 24 onwards. And these fibroids are basically estrogen related. So when there is more estrogen inside your body, free estrogens inside your body, this can cause the growth of fibroids. And as you attain menopause, wherein the estrogen reduces in your body or goes off, shuts off in your body, this fibroid is going to get reduced and shrink, and it will be just like a small amla, size of an amla. Okay. So what are the main causes of fibroids? How does this fibroids occur? So basically, I have told that because of estrogen. So when there is more estrogen, free estrogens inside your body, this can cause fibroids. And also when you have a family history, a close relative of yours is having fibroids, like your mother, sisters, or your mother's sisters, etc., then you are under high risk of developing this fibroids. Then ethnicity. Ethnicity, basically African American descents are more prone for fibroids. And also pregnancy, because if you have a small fibroid, very small or seedling fibroid, and when you attain pregnancy, this fibroid can grow along with your pregnancy, and sometimes it can hamper your pregnancy as well. So coming on to, this is a photo that you need to keep in mind, because until and unless you don't know which kind of fibroid or where the fibroid is situated, you will be unable to treat the patient. So without understanding this, we cannot go forward. So basically, there are three types of fibroids. The basic fibroid is intramural fibroid. This is seen in the myometrial layer. That is the second layer of the uterus. Okay, when this intramural fibroid is growing towards or inside the cavity, that kind of fibroid is called as submucosal fibroid. And when the same intramural fibroid is growing towards the outer perimetrium or towards the outer layer, then it is called as subserosal fibroid. And then you can also see pedungulated fibroids, which will have a pedicle. Okay, you can see pedungulated submucosal fibroids or pedungulated subserosal fibroids. So when you get a patient with uterine fibroids, first you need to know where the fibroid is situated or what kind of a fibroid it is, whether it is a submucosal fibroid or whether it is a subserosal fibroid. So basically, by seeing this image, we can understand that if this fibroid is a submucosal one, it can cause a lot of conditions or it can cause a lot of problems like excessive menstruation, dysmenorrhea, and it can hamper implantation. That is, this can lead to infertility. And when you see a subserosal fibroid, and if the subserosal fibroid is more than 2 centimeters and is situated in front of the uterus, that is in the anterior wall, in front of the uterus, you can see a lot of urinary issues like urinary incontinence, repeated urinary tract infections, etc. So until and unless you understand where this is situated, it will be difficult for you to understand the case. Okay. So these are the risk factors. As I had already told you, genetic factors, and if you are overweight, because see, why overweight? How does overweight and fibroid is related? Because when you are having more weight, you are having more bad fat, LDL, or triglycerides increases inside your body. So this can lead to the formation of excessive estrogen. And there is a hormone called as SHBG, sex hormone binding globulin, which is formed from liver. And this SHBG binds with the estrogen and is made into a useful form. But when there is excessive estrogen inside your body, then there is no enough SHBG inside your body. And these excess estrogen can lead to conditions like fibroid and also fibroadenoma in the breast. Okay. Then it is more common in African American race. And when there is vitamin D deficiency, that can also lead to formation of these uh, fibroids. Birth control pills. Birth control pills are usually 21 days tablets of a combination of estrogen and progesterone tablets, wherein it causes excessive amount of estrogen inside your body. The next one is early onset of periods. When you get periods before 10 years, this can lead to fibroids. And alcohol usage and diet low in fruits and vegetables. So what are the symptoms? There will be dysmenorrhea, irregular cycles, excessive bleeding, bloating, and excessive vaginal discharges. Sexual contact will be painful and low back pain. And sometimes you will get conditions like constipation and also urinary incontinence. So these are the treatment options for uterine fibroids as per modern science. That is, you can give NSAIDs, you can do hysterectomy or myomectomy, and also there is a new technique that is uterine artery embolization. So these are the common surgical procedures and the medical management that is being done currently. But we Ayurveda doctors do have a better option for uterine fibroids. So basically, we need to understand what is the nidana. You will get to know the nidana only by asking the patient. And you might see that the patient is taking unwholesome diet, hot, spicy food, or patient will be taking, will be a foodie. Means she will be taking a lot of food and excessive salt, etc. So these all can lead to visheshan of the kapha dosha and also the other doshas. This kapha dosha can go and hamper the srotasis. So this can vitiate the rasa, rakta, mamsa and medas dhatus and ultimately produce garbhashay granthi, asrigdhara, shula and gulma associated with garbhashay granthi. Okay. So first, what is the treatment? Nidana Parivarjana. So until and unless you ask the patient to do a Nidana Parivarjana, you will not get any success in your treatment. So first, along with the medicines that you are giving, you need to concentrate on Nidana Parivarjana. Okay. So let's see what are the Shamana Chikitsa and the Shodhana Chikitsa. So firstly, we can see the Shamana Chikitsa. So Shamana Chikitsa, first of all, Drakshadi Kashaya. Let me tell you, I am practicing in Kerala, so hence we use a lot of herbal preparations and less of the minerals or metals, rasaushadis. Okay. So I will be telling only the classical medicines because we rarely, very rarely use any patent medicines. So first one is Drakshadi Kashaya. Since it is Pittahara, it can be given in conditions with excessive bleeding. Trayandyadi Kashaya, which is Pitta Asrak Hara. So it can benefit in Kapha Hara also. So this can be given in excessive growth of the extra growth, means like about 2 centimeters growth of uterine fibroids, you can give Trayandyadi Kashaya. And Sahajaradi Kashaya can be given in seedling fibroids wherein there is Shotodushti. And this helps in clearing the Shotodushti. And Ashoka Kshiropaga can be given in patients suffering from excessive bleeding because of uterine fibroids. Varanadi Kashaya, again it is Medohara and Kafahara, hence it will be beneficial in reducing the size of the fibroids. Kanchanara Gugulu again can be given in combination with Varanadi Kashaya to reduce the size of the um, uh, uh, fibroids. Then Chandraprabha. Chandraprabha, it is very much Tikshna Ushna and it is also Deepana Pachana. Hence, it will be effective in reducing the Kapha dosha or correcting the Kapha dosha by its Tikshna Ushna Guna and also clears the Shrodorodha. But uh, uh, you should never give Chandraprabha during the menstruating period or in a patient who was having excessive bleeding because Chandra Prabha again can increase the Artava, sorry. Okay. Then Ashokarishta. Ashokarishta, it can be given to reduce the bleeding. Okay. And it is also given as a blood purifier and a hemostatic. Then Avipattikara Churna, Chiruvilyadi Grita, Shatdharnam tablet, all these are given for reducing the size of the fibroids. Musali Gadradi Kashayam along with Pushyanaga Churna is given in places where there is excessive bleeding. Chitraga Grandhigadi Kashaya and Trayandyadi Kashaya again will be effective in reducing the size of the fibroids. And here, Tiktaga Grita is very much used in patients who are having excessive bleeding. As a rasayana, we can give this Tiktaga Grita after the first Shamana treatment. As a rasayana, you can give Tiktaga Grita or Sukumara Grita. Gandharvasthadi Kashaya and Saptasaram Kashayam is used in conditions where there is Pitta Visheshan. Okay, to correct the metabolism. Then in dysmenorrhea conditions, this is very commonly seen. In a day, we get around 10 to 15 patients with dysmenorrhea minimum. So you need to understand there are two types of dysmenorrhea, that is primary and secondary. Primary dysmenorrhea, it occurs in all the young girls. We know that just had their menstruation from 12 to 18 years or 12 to 25 years, you can see primary dysmenorrhea. And secondary dysmenorrhea occurs majorly because of some underlying issues like endometriosis, uterine fibroids, pelvic inflammatory disease, etc. But here, what you have to understand is how will you differentiate whether it is a primary dysmenorrhea or a secondary dysmenorrhea? That is very important. So basically, if you get a patient with primary dysmenorrhea, she will be stating that she is getting pain before the onset of menstruation, and as the menstruation starts or as the bleeding starts, her pain is getting reduced. Okay, this is primary dysmenorrhea. Secondary dysmenorrhea are cases wherein she complains that the pain has started from the onset of her bleeding and it is continuing till the bleeding ends. So that is the difference. That is the main difference. So the first one will be around 8 to 48 hours or sometimes maybe 24 hours. Pain will be staying. In the secondary dysmenorrhea, it will be more than 3 or 4 days. Okay, so this is how you differentiate between the primary and secondary dysmenorrhea. So both the primary and secondary dysmenorrhea are having same treatments, are given same treatments as per Ayurveda. But in secondary dysmenorrhea, you need to understand what is the underlying cause. Until and unless you don't understand the cause, you will be unable to treat the patient. Okay. So this can be taken as Udavarta condition. So For major nidana that happens in dysmenorrhea, all kinds of dysmenorrhea, is suppression of natural urges. So we know that Vega na dharayati, but here the lady will be doing or the girl will be doing Vega dharana. So first of all, ask whether she is doing any kind of Vega dharana. If she is doing that Vega dharana, just by merely stopping that Vega dharana, stopping by doing that Vega dharana, then the apana vayu will be freed and the pain will also be reduced. Okay, so you can give medicines along with this advice to the patient. So I'll be discussing about endometriosis and adenomyosis along with dysmenorrhea because three of these are having almost the same kind of treatment aspect. Okay, so next one is endometriosis condition. So what do you mean by endometriosis? When this endometrial layer, which should be seen inside the uterine cavity, is coming out and getting lodged in some other place other than the uterine cavity. That is called as endometriosis. So sometimes you might be very familiar with some words like chocolate cyst. It's not because you are eating a lot of chocolates. It's because that this endometrial tissue is getting lodged or getting inside the ovaries and it is staying there and it is unable to go out. Okay, so when this endometrial tissue is getting lodged everywhere else, all these glands, all these cells, all these receptors will be present in those endometrial tissues as well. So whenever there is influence of uh, estrogen or influence of progesterone, these endometrial tissues are going to grow and these will menstruate at each places and it can cause severe pain. Okay, and this can spread also and cause adhesions, severe kind of adhesions. Okay, so the causes of endometriosis is first thing is it gets implanted somewhere or sometimes it passes through the or it moves through the bloodstream or sometimes it can be retrograde menstruation when the menstruation is going against the apana vayu and genetic causes, immune deficiency, sometimes metaplasia. Metaplasia means the cells going to some other places and growing there, just like a cancer cell. Okay. Then environmental factors. You must have heard about CA 125. CA 125 will be more in cases of endometriosis as well as in cases of CA endometrium. So how does endometriosis affect our body? So these are the symptoms that you can see because of endometriosis. That is painful periods. Pain will be very severe. The patient will vomit or the patient will have nausea. Then fatigue. Fatigue means she will be very much tired. And pain during sexual contact. That is dyspareunia. Then spotting in between the periods and infertility because of a lot of adhesions that is happening and poor formation of the ovum. Infertility can occur and pelvis or lower abdominal pain can occur. Neuropathy. Sometimes these pain can also form into go into the lower back region and it can cause pain that is very similar to sciatica pain. Then it can cause gastrointestinal issues. Major one is bloating. You might have heard patients coming to you and telling that I'm getting severe bloating during the periods time. Okay, so this is very common. And also they might be also sharing with you that they are having indigestion issues, either constipation or excessive diarrhea, etc. Okay, and heavy periods. The periods will be very more. That is, the patient will be having around, or patient will be telling you that I am using around 10 to 15 pads per day. And there is clotty appearance of the blood. Okay. So these are the modern method uh, treatment aspect. First one is sorry, not treatment aspect, examinations. So first one is we can do a bimanual examination. Second one is we can do laparoscopy. Laparoscopy is said to be the gold standard to understand, to diagnose endometriosis. And also we can undergo ultrasound. So better to go for first examination, second one ultrasound, and if you are still not clear, then you can go for laparoscopy. So the treatment options are excision or ablation surgery, pelvic physical therapies, medication for pain, that is NSAIDs, birth control pills, etc. And the main treatment is not to have periods. Okay, stoppage of periods for a period of 3 to 6 months, which can help in reducing the endometrial tissues that is lodged somewhere else. Okay. So here we can correlate it with the Vadaja Yoni Vyapat, wherein we can see that the lady will be a Vata Prakriti woman. Just analyze this when you're talking to the patient, whether the patient is having which Prakriti, that is Vata, Pitta or Kapha. Mostly the patient suffering from endometriosis will be having Vata Prakriti. And also the diet and activities. You can see that the patient is very active. The patient does a lot of jobs, especially the patient does a lot of gym activities or dancing or etc. activities during the periods also, which should not be done. And also diet. You can ask her, what kind of a diet are you taking? So she might tell you that I'm taking a lot of fast food items. I like fried items. I like more tikshna ushna items. I like pickles, etc. So all these things should be asked from the patient. Okay. And also Vegadharana should be asked. So here there is just a schematic diagram to show the visheshan of apana vayu. Basically in dysmenorrhea and in endometriosis and in adenomyosis conditions, there is apana vayu vaigunya. And you just have to correct this apana vayu. Okay. So coming into the Ayurvedic management. So first of all, as I told you, Nidana Parivarjana is the first treatment aspect. So you have to ask for any kind of Vegadharana, heavy exercise during menstruation, poor fluid intake, coitus during bleeding days, coitus in abnormal positions, stress, etc. These things are very important. Please note it down and ask your patient. So you will get good information from this. Okay. And once if you ask the patient to do Nidana Parivarjana, half of your job is done. And then rest half you can control with our Ayurvedic medicines. So as a Shamana Chikitsa, we can give Sukumara Kashaya and Saptasaram Kashayam, which both are effective in Apana Vayu Vaigunya. And Dhanvantaram Kashayam is used in conditions where there is, as I told you, pain like sciatica. Sciatica pain can be seen or excessive lower abdominal pain. For this, Dhanvantaram Kashayam is good because Dhanvantara Yogam helps in uterine toning. That's why. Then Gandharvastadi Kashayam, again for Vata Visheshan, Varanadi Kashayam for a Lekhana property or for reducing the endometrial tissues that is lodged. Okay. And then Trayandyadi Kashaya, again for Lekhana property. Mishraga Sneha as Anulomana. Mishraga Sneha not only does Anulomana, but it also has a Lekhana property. Then Hingvachadi Churna, which can be given along with Sukumaram or Saptasaram. And Hingu Triguna Taila at bedtime is very much effective in reducing the lower abdominal pain. Then Ashokarishtam and Draksharishtam or Abhayarishtam. Ashokarishtam will reduce the clotty appearance inside the bleeding. Draksharishtam again can help in Pittahara property. So reduces the bleeding. And Abhayarishtam can again help in Anulomana. Apanavayu Anulomana. Okay. And you can see constipation in endometriosis conditions or in dysmenorrhea, especially in dysmenorrhea. So you can give Abhayarishtam in that cases. Then Pipalyadi Anuvasana Thailam plus Sukumara Gridam will be helpful in reducing the pain conditions as it controls the Apanavayu. Then Gugulu Panchapala Churna with Guda will be beneficial in reducing the endometrial tissues that is being lodged somewhere else or causing adhesions. For removing the adhesions, you can use Gugulu Panchapala Churna. Jeevandi Churna will help in reducing the bleeding. Rakta Pittahara, Nirgundyadi Kashaya, taking the endometriosis concept as krimi. You can give Nirgundyadi Kashaya, Vilvadi Guliga, Dushi Vishari Guliga, etc. Then Gopi Chandanadi and Punarnavasava. These are given in combinations to help in reducing the pitta and also controlling the vayu. Then an adenomyosis case, similar to endometriosis case, in adenomyosis, the only difference is that this endometrial tissue goes into the myometrial layer. Instead of going out of the uterus, it goes into the inside the layer. So it goes inside and grows there. Again, same symptoms can be seen in adenomyosis also. That is excessive pain, excessive bleeding, and pelvic pain will be there, dyspareunia will be there, and severe discomforts like bloating, indigestion, constipation, etc. So here also you can do physical examination and ultrasound examination and understand that whether it is a adenomyosis or endometriosis case. Okay. Ayurvedic treatment protocol. So basically, we know that all these conditions need uh, apana vayu anulomana. So give whatever drug that is beneficial in vata anulomana. And also here taking the concept of shopa, because shofa means there is, here you can see there is the endometrial tissue is going inside the myometrium and causing inflammation. So considering this case as a shofa, you can treat it. Okay. Then again, Chirvilladi Kashaya, Sahajaradi Sevyam, because there is Srotorodha happening. So for that, you can have Sahajaradi Sevyam. Ashokarishtam, again, it's a uterine tonic and also helps in reducing the bleeding. And Shadharnam tablet, considering it as a case of Shofa. Okay. See, basically, you just understand what are the concepts in treating the condition, and then you will be able to understand what kind of medicines can be used at your end. Okay. Next one of the most common things, that is polycystic ovarian syndrome. Everybody will come and ask me what is PCOD and PCOS. Let me tell you, both are the same. But only thing is that in syndrome, we say that 2 or 3 conditions coming together is called a syndrome, and a disease means a single entity. So here syndrome means hirsutism, acanthosis nigricans, insulin resistance, and irregular cycles, anovulation, all these when coming together, it is called as PCOS, that is syndrome. But if the patient is suffering from only one thing, for example, only anovulation, then it is a case of PCOD, that is polycystic ovarian disease. That is the only difference, okay? And let me tell you, PCOS is very common nowadays. Around 95% of the women in reproductive age is suffering from PCOS. And let me tell you, with my experience and with the patients I have dealt with, PCOS is only caused because of your ahara, vihara, and mind. Only these 3 things. So until and unless you don't treat her for these 3 things, you are not going to achieve 100% result. And PCOS is something that cannot be completely taken out from your body and thrown. It is something that can be managed. Because if they again go into a different apatya or viharas, etc., again this can come. Okay. So there will be increased androgens. It can be a genetic issue. Insulin resistance can happen and inflammation inside the body. You must have heard that a lot of obese PCOS cases coming and telling that, Madam, I don't eat anything. I just drink water and I eat the air. I don't eat anything. Then still I am getting very much fluffy, or I am getting very much, I am increasing my weight. That is because of the inflammation cytogens that causes inflammations that is increasing inside your body. Okay. So basically, I'm not going deep into the pathophysiology of PCOS because it will take another 1.5 hours for me to discuss this pathophysiology. So just let me tell you, there is hormonal imbalance wherein there is more LH and reduced FSH. that is follicle stimulating hormone. So when the follicle stimulating hormone is not present adequately, this can result in non-proper growth of the follicle and lead to anovulation. Okay, or oligo-ovulation conditions. Okay. Then there will be increased insulin levels, reduced glucose tolerance. There will be increased testosterone androgen seen inside your body as. So how does this affect? So basically, you know that there is a lot of Instagram reels coming telling us that PCOS, this causes PCOS, this is the result of PCOS, etc. So let me just concise and tell you the proper causes or proper effects of this PCOS. First one, you will have hair loss. Second one, increased PMS, premenstrual syndrome, like getting mood swings, binge eating, etc. Then a lot of acne, cosmetological issues. Then you will get irregular cycles. You cannot predict your cycle. Sometimes you will get proper cycles for 1 or 2 months. Then again, it will go hampered. Means it will be like once in 2 months or once in 3 months, etc. Then again, it will come to 1 or 2 months, correct? Like that. So unpredictable periods can happen, or you will get irregular cycles. Then weight gain. Then insulin resistance will be there. As part of insulin resistance, you will get acanthosis nigricans. Then infertility because of anovulation condition. There is no ovulation happening, and because of that, you will get infertility. Then unusual hair growth, that is called as hirsutism. And also sleep issues can also happen. So these are the basic effects of PCOS. So how do you diagnose it? You can do some lab tests, and the basic diagnostic method is the pearl string sign seen in USG. So just here you can see that just like a pearls are put in a string, you can see that the cysts are there. Okay, these are all filled with cholesterol. When you rupture these, you will get cholesterol. So what do you need to understand? It's mere fat or mere indigestion or gut is the main problem here. Okay, so correct the Agni. Starting from Jadaragni, correct the Agni from Jadaragni till Dhatu Agni. You have to do proper correction of the Agni. Okay, so these are some of the biochemical tests that you can do. FSH, LH, testosterone, thyroid function test. Always thyroid function test will be elevated, or mostly it will be elevated in PCOS conditions, because TSH and pituitary gland is very much interrelated. Okay. Then treatment for PCOS as per modern science, that is birth control pills, anti-diabetic pills. Especially, I have seen a number of women eating metformin. They are eating metformin, they are taking the birth control pill, and they are binge eating, or they are eating all kinds of fast foods. Okay. So here we can take this condition as Pushpagni condition. So, and considering that, we can do the Ayurvedic treatment first by doing Agni Vartana. That is, correct your Agni, Jadara Agni, and then go to Dhatu Agni level. For this correction, you can use Dadimadi Grida, Ashtachurna, Vaishwanara Churna, Chandra Prabha, etc. These can help in correcting the Agni. So first correct the Agni, clear the gut. Then you can come into the hormone section. Then you have to do Kapha Medohara property or Kapha Medohara principle you can use after doing Agni Vartana. And then if it is a case of obese PCOS, it is very easy to treat obese PCOS. You can give Chirulladi Kashaya, Vaishwanara Churna, or even you can give Udvartana Takradhara, Sneha Pana with Tila Taila, then Vamana you can give. Okay, all these things are beneficial in obese PCOS conditions. And after doing this and after giving proper advice to the patient, if still not corrected, then you can opt for Vasti treatment. Any kind of Vastis like Yoga Vastis, Vaidyaratnam Vasti, Madhu Dailiga Vasti, Rajayabana Vastis, etc. can be done. Okay. Then Tila. Tila is one of a very beautiful drug. It helps, it has a estrogenic effect also, and it can help in correcting the cycles. Okay, menstrual cycles. Then Mahanarayana Taila, Ayaskriti, Varanadi Kashaya can be given in conditions of obese PCOS. And Sukumara Grita, wherein it can be given in lean PCOS, because lean PCOS is a little bit, you need to titrate the medicines always. It is little bit difficult to treat lean PCOS. Here you can give Kalyanagam Kashayam, Sukumara Ghritam, Dadimadi Ghritam, Saptasara Ghritam, or Saptasaram Kashayam, Kshirabala Nasyam after menstruation, etc. Because if you give Nasya with any medicine you can give, not with Kshirabala alone, you can give even with Anutaila. It's also okay because this will stimulate the HPO axis and create proper stimulation. It gets proper stimulation and FSH, follicle stimulating hormone increases. Okay, so folliculogenesis increases. PCOS with constipation, very commonly seen. So you can give Abhayarishtam along with Kumarias. PCOS with chronic amenorrhea conditions, for getting the periods, you can give Kanashadavadi Kashayam, Saptasaram. And even after that, you are not getting, then you can go for Vamana or Snigdha Vinejana can be used. Again, lastly, we are coming into Vasti. As a Rasayana or as a final part of treatment, you have to do Vasti. Vasti is, uh, it is said that it is Artha Chikitsa. But for me, or when gynecological disease is concerned, it is full Chikitsa for me, Vasti. So do Vasti and you can correct the Apana Vayu, and once the Apana Vayu is corrected, then no need to worry about it. You have corrected the condition. Then again, moderate PCOS. These are some scenarios that we get very commonly in our OPD. So just I have put that scenarios and I'm giving you the concept of how to treat such scenarios. So moderate PCOS with secondary infertility. So see for chronic constipation and oligomenorrhea and do anuloma treatment only. And in the first cycle, when you get a patient with heavy PCOS or severe PCOS, first cycle, give Ruksha Sweda, and also along with that, you can give Agni Vardaka medicines like Gandharvastadi Kashayam and Abhayarishtam. Second cycle, Virechana, with after doing Snehabana with Tilataila. With basic Tilataila will be effective, or with Dadimadi Grida or anything. Then after that, you can give Vaidyaratnam and Uttaravasti if needed. I don't suggest Uttaravasti in all the cases. Okay. So do Uttaravasti only if it is needed. Okay. Try to avoid Uttaravastis if possible, because Uttaravastis has a lot of complications associated with it. Okay. Then scanty menstruation, you can give Draksharishtam. Lakshmana Arishtam will be beneficial in controlling the excessive bleeding conditions. Okay. And Kumaryasam as a Garbhashaya Shodhaka, it is very much beneficial. So next, coming into a condition called as pelvic inflammatory disease, which is very commonly seen nowadays. Just a moment. Sorry. So pelvic inflammatory diseases, we know that pelvic inflammatory diseases basically occurs because of any kind of infection. The patient will be presenting to you with complaints of excessive uh, uh, um, white from the vagina since a long time. And since there is vaginal discharges, you can expect that PID may be formed. Okay. So PID basically means that inflammation because of some kind of infections happening to the uterus, to the fallopian tubes, and to the ovaries as well. Okay. So basically it is caused by bacteria. 85% of cases, it will be STIs, sexually transmitted bacteria. And these bacteria usually infect the cervix. But if left untreated, they can travel into the reproductive organs and cause PID. So basically, you should understand that a long-standing vaginal infection can lead to PID. Okay, so just see for infections. So in this condition, in this PID conditions, there are few things that you need to keep in mind. First of all, uh, vaginal health is very, very important here because we know that vagina is built with a very good flora. God has created it with a very good flora. So, but what we do is we use excessive detergents or excessive soap to feel that we have cleaned the area. But when you're using a lot of soaps or etc. things, it can hamper this vaginal flora, and the good bacteria will all be killed, and there will be bad bacteria entering into this vagina. This can cause vaginal infections. Okay. So symptoms will be lower abdominal pain. The patient will be having lower abdominal pain on every day. Not only on the periods day, but on every day she will be having slight pain at least. Then excessive vaginal discharges will be there. Sex is not at all possible in such conditions because it will be very much painful. Okay. So here we can consider this as a Pittaja Yoni Vyapat. Again, concentrate on the Nidana. Ask the patient whether she's having a lot of excessive hot, sour, salty substances. She will be taking and do Nidana Parivartana as the first line of treatment. And then as Shamana Chikitsa, you can give Tikta Grida or Nirgundyadi Kashaya, considering that it is a krimi condition, Vilwadi tablet, Gulu Panjabala Churna, Trina Panjamuladi Kashayam, Vilwadi, Dushi Vishari, Gugulu Tikta Gridam, Chandanasam, Brihatyadi Toyam. All these things can be given according to the condition of the patient. So first of all, you need to understand that this is a krimi. Even krimi kutara rasam or krimikhna vatti will be very much beneficial in these conditions. Okay. Next, coming into one of the most common conditions, that is vaginal infections. We know that there is not a woman who have not experienced vaginal infections in their entire reproductive life. So what kind of an infection it is, how the infection is coming, and what are the signs and symptoms that the patient is telling you. Based on that, we can understand what kind of an infection it is. Okay. Even though we give almost same treatment for all kind of infections, but we need to understand what is the power or how extent it has gone. Okay, so basically first one is bacterial vaginosis. It is very commonly seen. It doesn't have any smell. It is very clear, no symptoms, nothing. Okay, then very commonly seen is trichomoniasis. Trichomoniasis and candidiasis. So in trichomoniasis, you can see that it will be green, yellow, and frothy appearance. A pain with sexual intercourse, vaginal soreness will be there. The patient will be telling that I get burning sensation in my vagina, and dysuria also will be there. Okay, and you can, if you are inspecting the vagina, you can see red spots inside the vaginal tissue. That is called as strawberry cervix. Okay, then candidiasis conditions, this like a curdy white appearance of the discharge. This is called it can be diagnosed as candidiasis. There will be burning sensation, dysuria, dyspareunia. Okay. Then atrophic vaginitis. Atrophic vaginitis is very commonly seen nowadays because people post menopause are suffering with this atrophic vaginitis because of lack of estrogen. Okay. There will be intense pain, dyspareunia, and also postcoital bleeding sometimes can be seen. These are the main varieties. Okay. So there will be itching. Commonly, you can see that there will be itching, pain during sexual contact, swelling and rashes, burning sensations while urine, and excessive discharge can also be seen. So we can consider this condition as Paripluta Yoni Vyapat, wherein Vegadharana will be one of the Nidanas, and also there will be Pitta, Vardhaka, Ahara, and Viharas. So ask for this and do Nidana Parivarjana. Then also we can consider in pregnant women. Also we can see this infections and we can consider the test Upapluda condition, wherein there will be diet and Vegadharana. Okay. The diets that vitiate the kapha and Vegadharana will also be there. So you can consider this in Nidana Parivartana. Then here also just some of the correlations like Pittala Yoni Vyabhat, Slaishmiki, Acharana, etc. And Acharana is basically because of krimi, unhygienic conditions, constant pruritus, intense sexual desire, unable to receive Shukra Bija. These Acharana Yoni Vyabhat can lead to infertility as well. Okay. So basically, here what you have to understand is I'll tell you 2, 3 factors that you need to tell your patients. First thing is don't use any kind of soaps, detergents, creams, perfumes in your vaginal part or in your vaginal region. And always clean the vagina with the help of warm water. Okay, should be warm water. And second one is you can use Aragvada or any kind of like Nimba, etc., Haridra, etc., for boil it in water and strain it, filter it, and then use it for washing. This can also help in reducing the vaginal discharges. Always wear cotton underwears, 100% cotton underwears, and remove the hair from your perineal part completely so that there is no wet condition that remains. Okay, you should always maintain dryness in the perineal region. And whenever you go to washroom, after washing that area, you have to dry that area with the help of a cloth, and then only you should wear the underwears. And when you're using pads, sanitary napkins, always, even though there is only spotting, remove the sanitary pad or change the sanitary pad after every 6 hours. And if it is just very spotting or very mild bleeding, it is better to go for cotton cloths. Okay. So these are the things that you need to educate the patient. Then Bahya Prayogas with Trifala Kwada, Aragodadi Kwada. Aragodadi Kwada is used when there is more itching sensation. Negrodadi Ganakwada or just nearby Nimbatvak, Ashogatvak, Haridra Chandana, Yeshtimadu, etc. You can make Kashaya and use as Yoni Shalana. Then Yoni Dhupana with Dashamula Kwadas or Haridra, Kushta, Nimba, Gugulu, etc. You can put and you can do Yoni Dhupana. And Yoni Kalka Dharana with Chandana. In burning conditions, you can do Yoni Kalka Dharana with Chandana and Nimba and Trifala paste. Yoni Pichu again with conditions of Dahana where there is burning sensation. Jatyadi Keram, Jatyadi Grudam are very much beneficial. Trifala Thailam, Bala Thailam, Shatapushpa Thailam, Murrivenna and Chandanadi Thailam are also useful. But make sure all these thylams are having a dampness, causing dampness. So whenever you ask the patient to apply it, you should also ask the patient to remove it completely. Okay. After a certain period of time, maybe half an hour or 2 hours, etc. Then Shara application, Kalyanak Shara and Kshara Taila or Tankana can be used in conditions of cervical erosion, where after severe or consistent vaginal infections can cause cervical erosions, HPV infections also. So here you can use Tankana, Kshara Taila, etc. So all these conditions, Shodhana is a must. Pitta Visheshan is true in all conditions. In every conditions, you can see Pitta Visheshan. So Virechana will be a line of treatment and Nitya Virechana with Trifala Kwada is the best that you can give in vaginal infections. Okay. These are the Shamana treatments, Manjishtadi Kwada, Gugulu Tiktanga Shayam, Patoladi Kashayam, Nirkundyadi Kashayam, Pushyaniga Churnam, etc. See, all these are commonly used in our OPD. Okay, I don't want you to use only these things. You can just understand the concept and use the medicines that is available at your place. Okay. Then Arishta Asavas like Chandarasava, Ushirasava, when there is more burning sensation, then Khadira Arishtam, when itching is present, Lakshmana Arishtam, when associated with infertility conditions, Aragoda Asavam, again itching, Nalikera Asavam, Chandraprabha, Gandhaga Rasayana, and Triphala Gugulu. As far as I am concerned, Gandhaga Rasayana and Triphala Gugulu is a Ayurvedic antibiotic for gynecological diseases. Gandhaga Rasayana and Triphala Gugulu in combination. Coming into the primary thing, even though I have told you about the medicines, I want to stress on this aspect of Patya. So the things that they can have, the Patya Ahara that the patient can take are they can take enough amount of fruits, enough amount of cereals, enough amount of water, and they can take non-veg, but make sure they are taking um, lean non-vegetarian things. Okay, like avoid heavy means heavy to digest chicken, mutton, etc. And it's better to use fish like once a week or so, but better to use it in the form of curry, not in the form of fried items. Then they can take uh, buttermilk. Buttermilk is very good for their body, but taking curd on every day causes abhishyanda, and it can lead to gut issues and cause gynecological diseases directly. So try to avoid curd on everyday basis, but instead buttermilk, that is chas. Chas is very good for your body. Okay, you can take chas on everyday basis. Butter is also good. Then dry fruits, then all kinds of vegetables can be taken except potato, because potato can cause a lot of carbohydrate inside your body. It can hamper your metabolism, because see, when you're taking potato, you will be taking potato along with some other items. So just imagine the if okay, for example, I will tell you that you are taking potato curry along with chapati. Okay, chapati takes less time to digest than potato, right? So what happens? You are taking chapati, it gets digested, but there is still potato, undigested potato, which can cause ama inside your body, cause gut issues, and directly cause menstrual problems. So this is how it works. So when you are taking the food, you need to know for how long it will take for digestion, and you need to understand that. Okay. Then intake of dried fish, pickles, all kinds of pickles, excessive sugar, salt, alcohol, bakery items. Bakery items includes all those items that are fried, or biscuits, maida. All these things needs to be cut down. And use of curd on everyday basis should not be allowed. And also intake of more fast food items, or bakery means like all those sweet items, etc. should be avoided completely. Okay. So I'm concluding today's session by giving you some information about the gut, mind, and endocrine cycle. Again, reminding you about this and stating that anxiety caused by modern life also leads to the increase of gynecological diseases. Therefore, a healthy lifestyle with a balanced diet, enough rest, and without stress would effectively prevent gynecological diseases. So let me again stress about this patyas that needs to be focused, and also understand the nidana of each person or each patient that comes to you, and the prakriti of each patient, and give them proper diet, exercise, and mental health along with your medication, and you are going to succeed in your practice. Thank you. Thank you so much for patiently listening. Thank you.
धन्यवाद मैडम। आपने अत्यंत सरल एवं क्लिनिकल दृष्टिकोण से इस महत्वपूर्ण विषय को प्रस्तुत किया। हम अब अगले सेशन की तरफ चलते हैं, जिसमें प्रश्नोत्तर सत्र की ओर बढ़ते हैं। यदि किसी प्रतिभागी के मन में कोई प्रश्न हो तो कृपया अपने प्रश्न प्रस्तुत करें। कोई प्रश्नकर्ता?
Please check chat box if it is there.
ओके। एक प्रतिभागी का प्रश्न है कि डिफरेंशियल डायग्नोसिस बिटवीन द यूटेराइन फाइब्रॉइड एंड द एंडोमेट्रियोसिस। मैम।
Yes, okay. Thank you for the question. So basically, when you want to differentially diagnose both uterine fibroid and endometriosis, you need to undergo tests. So basically, USG can help in understanding or differentially diagnose whether it is a uterine fibroid condition or endometriosis condition. Because in both the conditions, there can be menorrhagia, excessive bleeding, and there can be dysmenorrhea also, secondary dysmenorrhea. So it's better to go for USG. Okay, I'll read the questions. I hope she's satisfied with this answer. And next question, for most Yoni Vyapa, Daiva Vyapashraya Chikitsa is the primary treatment. Yes, of course. I 100% agree with your question. Daiva Vyapashraya Chikitsa is a must in all the Yoni Vyapats, not only in Yoni Vyapats, in every other condition. You need to have Daiva Vyapashraya Chikitsa, as I told you in first itself, that karma, whatever karma we have done in our past life can reflect in this present life. So that's why I told you the question that many patients come and ask, tell me that, Madam, I am using only pure vegetarian. I am a pure vegetarian, and I have my food at time. I drink enough water. I take a lot of vegetables and fruits, etc. Then how come got this uh, cancer? Because we had a patient, CA cervix. So she came and asked me this question. She's a part of some kind of program, and she does yoga and she does everything. And she asked me how I got this. None of her family members have this history of CA. So mostly it might be the karma that she has done in the past life. So of course, Deva Vyapashraya Chikitsa is very much needed. Not only you should advise this to your patients, but also you should also, as a doctor, you should also have, uh, presence of God when you're giving medicines. Because it is told by my acharya that uh, if you give the medicines, like just write and give the medicines, it is not going to affect. But if you just take 30 seconds, just pray to God and give the medicine, it is going to affect. So you can try that. Basti means Uttara Basti, Niruha Basti, Anuvasana Basti, Matra Basti. See, Basti, basically what I meant is uh, as a yoga Basti. You can do Madhu Tailiga Bastis, you can do Matra Basti, etc. But basically, Yoga Basti pattern is what we follow here. Sometimes, in some cases, we give Karma Basti also. So you can decide according to the patient. I have not meant Uttara Basti in all the cases, because Uttara Basti, I personally perform Uttara Basti in patients who really need Uttara Basti. That is in conditions of infertility. Mostly in conditions of infertility, I carry Uttarabastis. Otherwise, I try not to do Uttarabasti because Uttarabasti is having a lot of complications. You should be very, very careful when you are doing Uttarabasti. So that is what I meant. Okay. Any other questions?
करंट वे ऑफ मैनेजमेंट ऑफ पीसीओडी एंड पीसीओएस जो आपने बताया मैम।
Current way of management of PCOS and PCOS. Okay, fine. Um, See, basically, when you are treating a case of PCOS and PCOD, first you need to understand what kind of a PCOD or PCOS it is. Because there are different kinds of PCOS. Like, for example, I will tell you, a patient coming to you with complaints of irregular menstruation only. You did the USG, you came to know that both the ovaries are a little bit bulky because of polycysts, and that is the only condition. So you have to give medicines to correct her cycle. That is that irregularity. The irregularity needs to be corrected. You can use Kanashadavadi Kashayam, Saptasaram Kashayam, etc. But always before treating this case, you should understand her Patyapatya. Means what all ahara vihara she is undergoing, and then give her. Always in my prescription is in such a way that I will give medicine, I will give diet, I will give exercise, and I will give mind, focus to mind. So these four factors complete my treatment. So the same way, understand what is her condition. Sometimes she is coming to you, she is having regular cycles, no problem with her cycles, but she is having, she is infertile. So here you need to focus on anovulation. Anovulation might be the cause for her infertility. So you have to treat anovulation. So there you have to give Kafahara treatment, and you can give Vasti treatment so that her ovulation will be corrected. And also you can use Shata Pushpa. Shata Pushpa is very much beneficial in ovulation or in creating a good ovum. Okay, I hope it's clear. Patient is 26-year-old unmarried, but with 2 or 3 days of menstruation only. HB is 12 grams and only slight pain in abdomen for a day. Srodhorodha is the main cause for this, or the main reason. So correct the Srodhorodha and correct the Apana Vayu. And I doubt that she might be a little bit lean also sometimes. So you have to correct the uh, Jadarakni, Dhatwagni, and Srodhorodha also, these conditions. How to management of ovarian cyst more than 5 centimeters. More than 5 centimeters ovarian cyst is a danger. It can cause torsion and death of the patient. So basically, it would be great if she can go for laparoscopy and removal of ovarian cyst, because she might have torsion of that cyst. If it is 5 centimeters, 5 centimeters, it is big. So it can cause torsion. So immediate laparoscopy will be beneficial in this condition. Female patient aged 46 years complains of bloating and pain during cycles, not responding to antispasmodic, USG normal, right ovary operated for chocolate cyst. How to proceed? Vegetarian, following yoga, walk, meditation, follows good lifestyle, weight is 65 kgs, height is 5'2". Great. So history of chocolate cyst means history of endometriosis. She might be having endometriosis. Maybe the endometrial tissue will be lying anywhere else other than the uterine cavity. So first see for that. Maybe she can go for laparoscopic diagnostic purpose also. And for complaints of bloating and pain during cycles, it is better to give some medicines that will help in anulomana, that is Gandharvastadi Kashayam or Saptasaram Kashayam with Hinguvajadi Churnam or Vaishwanara Churnam will be beneficial. Mere Dhanvantaram tablet will also be beneficial in this condition. Treatment for endometriosis and fibroid, I think I have already discussed it. Please explain ovarian cyst, hemorrhagic ovarian cyst, or simple ovarian cyst. It's Ayurvedic treatment. That's a huge topic, talking about ovarian cyst. But still, I will just concise and let you understand the principle of treatment of ovarian cyst. So basically, there are a lot of cysts. Tubo-ovarian cyst, sometimes ovarian cyst alone, and hemorrhagic cyst means chocolate cyst because of endometriosis, and there might be simple ovarian cyst also. Simple ovarian cyst need not be given any medicine because it will resolve on its own if it is small sized. But if it is very big sized, then either excision needs to be done or some kind of Lekhana medicines needs to be given. Okay, for this Lekhana Vasti, Vaidharana Vasti, etc. will be beneficial in simple ovarian cyst condition. Same goes with tubo-ovarian conditions. Tubo-ovarian cyst means because of PID, pelvic inflammatory disease, and some kind of infections. So just understand the infections and treat in the same way that I have told for PID conditions. Hemorrhagic cyst means treat it if it is small sized, that is below 2 centimeters and all, then you can go for Lekhana property medicines and treatments. It will resolve, or else in the next cycle, it might rupture and with severe pain, it will go. Okay. As you said for erosion, apply Shara. What is that method via Pichu or something else? See, for erosion conditions, that is cervical erosion conditions, we usually apply Tutta, etc. Sharas. We will apply directly on the cervical eroded areas and treat it in the way of Brana. That is with Jatyadi Krita or Jatyadi Thaila, we will treat it. Okay. Not keeping any kind of pichu. We only do dahana for around 100 seconds. We will keep it for 100 seconds or maybe like 2 or 3 minutes. And then after that, we will wash the area with normal saline. And then we can keep pichus which are which are dipped in Jatyadi Keram or Jatyadi Ghrutam. That will. Or Shadadauda Ghrutam. Anything. Okay.
और कोई प्रश्नकर्ता?
समापन कीजिए।
धन्यवाद मैडम, आपने सभी प्रश्नों को बहुत अच्छे से समझाया हमें। अब हम कार्यक्रम के समापन की ओर बढ़ते हैं। इस अवसर पर मैं प्रांत अधिकारी संक्षिप्त परिचय प्रस्तुत करना चाहूंगा। वैद्य संतोष जी गटणे, सचिव आरोग्य भारती पश्चिम महाराष्ट्र प्रांत, महाराष्ट्र आरोग्य विज्ञान विद्यापीठ नासिक के सीनेट सदस्य एवं स्थायी समिति सदस्य, आयुर्वेद चिकित्सक एवं आयुर्वेद औषध निर्माता, पुणे में है। अब मैं विनम्रता पूर्वक आमंत्रित करता हूं आदरणीय वैद्य संतोष जी गटणे को कि वे अपने समापन उद्बोधन से हम सभी का मार्गदर्शन करें। वैद्य जी।
सभी को नमस्कार। Am I audible, sir?
यस सर। नमस्कार सर।
नमस्कार। आज के इस महत्वपूर्ण सत्र में हमें अच्छे ज्ञान प्राप्ति का अवसर प्राप्त हुआ है। तो आज के वक्ता जो हमें प्राप्त हुए हैं उनका मैं हृदय तल से आभार व्यक्त करता हूं। वैसे ही सारे श्रोताओं का जो यहाँ उपस्थित है उनका आभार व्यक्त करता हूं। विशेष रूप से आज के इस आयुर्वेदा बेसनम के सत्र के उद्घाटक के नाते उपस्थित रही डॉक्टर प्रतिभाताई पाठक, जिनका पूरा परिवार ही वैसे समाज सेवा से जुड़ा हुआ है। प्रतिभाताई आयुर्वेद से ही ग्रेजुएट है और जिस संस्था के द्वारा वो काम कर रही है वो संस्था का काम आरोग्य भारती के कार्य के जैसा ही एक कार्य है। इसीलिए हम सबको आरोग्य के क्षेत्र में सेवा के द्वारा कैसा काम किया जाता है या सेवा कैसी की जाती है इसका यह उदाहरण स्वरूप है। इसलिए उनका कथन यह जैसे उद्घाटन के लिए था आज का, वैसे उनके बोलने तक जो भी हुआ है वह बोलना आज के लिए वही सब लोग समझ जाए, यही आज का समारोह है। इसलिए प्रतिभाताई ने जो कुछ भी कहा और जो कुछ भी वो कर रही है वो सब लोग समझ जाए और उनका अनुसरण करे, इस विनती के साथ आज के इस सत्र का समापन मैं करता हूं। धन्यवाद।
धन्यवाद सर, आपके प्रेरणादायी शब्दों ने इस कार्यक्रम को एक सार्थक एवं प्रभावी समापन प्रदान किया है। अब मैं इसके बाद वोट ऑफ थैंक्स के लिए मैं आमंत्रित करता हूं डॉक्टर मनोज चौधरी जी का। आप अष्टांग आयुर्वेद महाविद्यालय पुणे में सह-प्राध्यापक एवं विभागाध्यक्ष हैं। साथ ही आप आरोग्य भारती पश्चिम महाराष्ट्र प्रांत के भारतीय स्वास्थ्य चिंतन आयाम के प्रमुख भी हैं। सर।
यस, नमस्कार। आज
नमस्कार।
के आयुर्वेदाभ्यसनम के 30वें सेशन में उत्तम मार्गदर्शन प्राप्त हुआ हमारे आदरणीय वक्ता डॉक्टर राधिका सतीशन। इनका मैं आरोग्य भारती पश्चिम महाराष्ट्र प्रांत की ओर से आभार व्यक्त करता हूं। आज के हमारे प्रेरणादायी उद्घाटक मार्गदर्शक डॉक्टर प्रतिभा फाटक जी, जिन्होंने अभी अभी समापन उत्कृष्ट पद्धति से किया और जिनके मार्गदर्शन में ये श्रृंखला चल रही है अविरत, वैद्य संतोष जी गट ने, हमारे प्रांत सचिव, सूत्र संचालक, बहुत ही अपने हृदयपूर्वक जिसको पूरा योगदान देते हैं ऐसे डॉक्टर अविनाश लबाना जी, आयुर्वेदाभ्यसनम की हमारी पूरी नेशनल टीम एवं पश्चिम महाराष्ट्र की टीम, खास करके हमारे संगठन सचिव अशोक जी वार्ष्णेय, अध्यक्ष राकेश जी पंडित, हमारे राष्ट्रीय सचिव सुनील जी जोशी, पश्चिम महाराष्ट्र प्रांत के हमारे डॉक्टर विनायक जी कुलकर्णी, और विशेषतः इस हमारे आयुर्वेदाभ्यसनम जो ऑनलाइन नेशनल श्रृंखला चल रही है उसके संचालक टीम जो है वो डॉक्टर हमारे देवदत्त जी देशमुख, रेशमाताई कुंभार, कमलेश महाजन, राहुल गवड़ी जी, आदरणीय डॉक्टर प्राजक्ता पटेल जी, खुशी जैन मैम, ज्ञानेश जी जोशी, वैद्यराज अमेय गायधनी, और सबसे महत्वपूर्ण जिनके सहभागिता से ये व्याख्यान श्रृंखला दिन ब दिन प्रसिद्ध हो रही है, आप सब पार्टिसिपेंट्स। तो आप सभी का मैं हार्दिक धन्यवाद और आभार प्रदर्शित करता हूँ। ओवर टू यू डॉक्टर अविनाश जी।
धन्यवाद सर। अब हम आगे, मैम ने जैसे एक पूरा विषय हमें समझाया कि उनका विषय था कि नारी स्वास्थ्य की सुरक्षा ही एक स्वस्थ समाज की सबसे मजबूत नींव है। और वेदों में भी कहा गया है कि यत्र नार्यस्तु पूज्यन्ते रमन्ते तत्र देवता। तो मैम का इस विषय, मैम ने जो ये विषय हमें मार्गदर्शित किया है, जो भी क्लिनिकल सब, उनके लिए मैम का मैं बहुत आभार व्यक्त करता हूँ। अब मैं शांति मंत्र से इस सेशन का हम समापन करेंगे। ओम सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामया, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःखभाग् भवेत्। ओम शांति शांति शांति, सर्वरिष्टेषु शांतिर्भवतु। धन्यवाद सर।